Physicians spend their lives fighting enemies they often never see. But the devastation of those diseases are laid out in front of them every day. Dr. Summers, good to meet you. Eric Summers is the Chief Medical Officer at Wake Forest Baptist Medical Center. Do you remember when you first heard about COVID?
Yes, I do. It was probably November, end of November, about China and that there's something was going on over there.
But you can't react overly to everything. So what do you remember do you remember what your thoughts were like? Well, let's just keep an eye on this, or do you think, oh man?
No, I was like, let's keep an eye on this. I remember talking with infectious disease about it, but we thought, okay, let's watch it. But we didn't, from past history, a lot of these viruses, it's not a pandemic. And so while we were watching it, I don't think there was the concern initially. That was true everywhere.
COVID-19 is part of a family of viruses we dealt with before, but this year's version was unique. As I've heard some health professionals say, there is no playbook for COVID.
Medicine doesn't go by a playbook. Patients don't go by a playbook. There's always details or nuances or things that you're not expecting. So that's kind of what we're trained for, is to be prepared for the unexpected. As it progressed, we didn't know everything, but we had to, in the moment, for lack of a better term, audible, react, change, and we've done that.
Some of the protocols and medicines they're using now are not what they used back in March, which is why the most valuable skills many of these health professionals have are mental stamina and an ability to think in new ways. Have you ever seen anything in your work that does what this one does?
No, I have not.
Sarah Foster is a respiratory therapist at Wake Forest Baptist.
Well, it's very, very different and has been different from the beginning up until today.
So what have we learned over those 5 months or so about this disease and what it does to the lungs?
Oh, we've learned a lot. Well, it almost seems like it floods the lungs.
So what's happening? There's a lot of fluid in there, so the oxygen can't get through into the bloodstream?
Yes.
And that can be terrifying. For some who deal with COVID, it can almost be like slowly drowning.
I was surprised at how patients deal with this condition. It's extremely debilitating. It can really, it affects your lungs tremendously, can take down your lungs. You can't breathe.
At Wake Forest Baptist, like at hospitals all around the country, there is a determined confidence that they will get this pandemic under control. But that may be the best that we can hope for. COVID-19 could become the constant foe, always lurking in the darkness, hoping for a chance to attack en masse once again.
Personally, I don't see an end to it. Just the basic knowledge of viruses, they're ever evolving and adapting. So yes, we might find a virus type A and develop a vaccine, but the virus develops, like the flu virus, every year it changes. So I think it's going to be an ongoing situation.
Bob Buckley, Fox 8 News.